Hello and welcome to my channel. There's some big changes coming to Medicare in 2026 and they could directly affect your coverage and your costs. My name is Jacqueline Levitt. I'm a licensed agent in over 20 states and I help people just like you maximize their Medicare benefits. So in 2026, there's going to be some big changes happening with Medicare, and a lot of these changes are in relationship to the Inflation Reduction Act of 2022. In 2025, the major change to Medicare recipients was the prescription payment plan. 2025 was the first year that the Medicare prescription payment plan was put into effect, and it allowed people to spread the cost of their prescription drugs over the calendar year versus paying in full at the pharmacy counter each time they get a prescription. For 2026, Medicare prescriptions and benefits will be affected in the following ways. So, number one, prescription payment is going to be on an automatic enrollment in 2026. So in 2026, if you are going to be enrolled in the prescription payment plan, you'll automatically be re-enrolled the next year unless you opt out. So just be aware of that. And if you do decide to opt out, CMS is going to require plan sponsors to process the opt-out requests within 3 calendar days rather than what they initially said, which is 24 hours. So number two, the cap on prescription drug expenses is going to increase. So the cap on the prescription drug expenses in 2025 was $2,000. In 2026, the cap is going to go up to $2,100. So just keep that in mind when you're picking up your medications in January. It'll be a little bit more. Number three, the Part D deductible is going to be increasing. So the Medicare Part D deductible is going up in 2026. The Part D deductible was $590 in 2025. The deductible for 2026 is actually going to go up to $615. So then you're going to pay all of the out-of-pocket costs until you meet your plan's full deductible. And then after that, you pay 25% co-insurance for both generics and brand name drugs. And again, this is what you're going to pay up until you reach that $2,100 in 2026. Number four, value-based SSBCI is going to be reduced or removed. So a lot of the value-based benefits that were available in 2025 will be going away in 2026. Many individuals who were receiving help with food and help with your utilities will be reduced or removed unless you have a chronic condition such as diabetes, heart disease, cardiovascular disease, kidney failure, etc. Then you won't be able to get those benefits going into the new year. So just keep those things in mind, because if you're one of the folks that receive those benefits, that's going to change for you. Many of the major companies have resorted to going to chronic special needs plans as more of an option for individuals. So keep that in mind. There's even some new plans for people that have obesity or even metabolic issues. So check on Medicare.gov using your zip code in your local area, or you can talk to an agent in your area that may have access to those plans and can go over it with you. This also affects programs for the chronically ill. So there's a such thing as special supplemental benefits for the chronically ill, which is also known as SSBCI. You may have seen this in the summary of benefits for your plan. Those benefits are provided to you, and it's usually based on your chronic condition. You can check your plan to see what the benefits are and what the criteria would be to qualify. Number five, insulin is going to be capped annually at $35. So since 2023, insulin was capped at $35 per month or less. This cap is now going to apply annually, beginning in 2026. So just make sure that you know that there's no deductible that's going to be applied to your insulin. There's zero cost sharing for vaccines, which will be permanent going forward. And if you need to get a list of those vaccines, you can always go onto the CDC website to look at that. Number 6, prior authorizations on original Medicare. Now, this is something that I saw that I was surprised about, that'll be different in 6 states this year and has not been done in previous years, which is prior authorization on original Medicare. So in the past with Medicare, there wasn't prior authorization needed to get certain services, but coming in 2026, there's going to be 6 states that have prior authorizations for certain care and procedures that you might need. Those 6 states are New Jersey, Ohio, Oklahoma, Texas, Arizona, and Washington. So if you're living in those states and if you choose to stay with original Medicare, just know that they're going to be using a system. It's called WISER, which stands for Wasteful and Inappropriate Service Reduction. It's a model that they're going to use to do the prior authorizations evaluations. So CMS, which is the Centers for Medicare and Medicaid Services, will be using AI for some of these things to do a review of what you need. But the final decisions are still going to be made by a real person. So rest assured that AI won't be making those prior authorization decisions for you. So that would be a reason that you may want to look into some type of plan, whether it be an Advantage plan or a supplement plan, to help pick up some of those unknown costs. Number 7, there's going to be some new plan offerings. So there's some new offerings in some areas when it comes to Medicare Advantage plans. There's some new companies out there in some areas that are going to be offering plans that weren't in certain markets for 2025. And in no way, shape, or form am I promoting any particular company, but just to give you a couple of examples, Devoted and Clear Spring Health are a couple companies that have expanded their plan offerings in 2026. Number 8, the Part A and Part B premiums and deductibles are going to be increasing in 2026. So the Part B premium is going to $206, up from $185 in 2025. So this isn't unusual. The Part B premiums continually go up every year. What's interesting is that this year it's actually going to be going up significantly to 11.6%. So that's quite a bit, much higher than previous years. But the Part B annual deductible is projected to increase to $288 in 2026, whereas it was $257 this year. The Part A deductible is going to $1,716. So with the Part A deductible, if you don't have a Medicare Advantage plan and you have original Medicare and that's all you use when you go to the doctor and to the hospital, then if you were to go into the hospital, you would have to pay the $1,716 before Medicare pays its part. And then that Part A deductible also applies to a benefit period. So the benefit period starts with an inpatient hospital stay and it ends after 60 days without care. So if you're a person who's prone to going into the hospital on a regular basis and you have some medical issues, just know the deductible applies to each benefit period, not just once per year. So these are some of the big changes coming for 2026. Let me know if you have any questions or what you're curious about for 2026, and I'll make a video about it. You can go onto Medicare.gov or you can reach out to your local agent or broker who'll be more than happy to help you get the information you need to make an informed decision. So hopefully this helps. As always, you can go to my website at www.jacquelinelovett.com, where you'll find a lot of great information about Medicare, and you can sign up to get a consultation with me. As a gift for viewing my video, I'm giving away a copy of my newest book, A Busy Professional's Guide to Vegan Fitness, for free. So visit my website to download your free copy today. There you can get some great tips on your health and fitness journey. I always say that the best insurance is great health. I know the holidays are going to be coming up, so everybody's going to be eating and drinking. So if you want to get a head start on your New Year's resolution, there's some great information there for all my members who go through this YouTube channel. But in the meantime, happy Sunday and have a great rest of your day. Bye-bye.